Good morning. On behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, I'm Dr. Dangleben. And what do I want to talk about today? I would like to talk about pancreatitis. Right? Pancreatitis as it relates to alcohol use. And the last four topics have been focused on alcohol because obviously there is an alcohol problem. Pancreatitis is severe inflammation of the pancreas. You can have acute pancreatitis or you can have chronic, which is recurrent, long-term, which causes a lot of damage, right? But as a practicing physician for many, many years, pancreatitis can be one of the most devastating and most painful things to deal with, right? I always say that you can go from 0 to 100 in no time with pancreatitis and cause significant damage, even mortality, right? And the leading cause of pancreatitis is alcohol use, heavy, prolonged drinking, okay? And again, you tend to see it more in lower socioeconomic backgrounds, meaning in poverty-stricken area, because that goes hand in hand with alcohol consumption, the excessive use, right? Drowning the pain. So, as I stated, who gets it? Heavy alcohol users, typically men between the ages of 30 and 50. But now with women drinking heavily, increasingly, you're seeing that an increase in women also. Low-income population, alcohol is often used as an escape, right? So the more poverty you have, the more alcohol consumption you have, the more unemployment you have, the more alcohol consumption you have, right? Numbing the pain, right? So, and in these communities, what happens? You don't have, fine wine and things like that. You have cheaper, stronger forms of alcohol, very accessible, and we all know that, right? And that compounds the risk. And you put on top of that smoking, malnutrition, right? Poor diet. All that increases the risk. So with pancreatitis, it's a life-threatening condition, man. I've seen it so many times, and I trained in the tail end where we were still operating on pancreatitis, and these patients actually never did well once you operate on them, right? You have chronic pancreatitis in the recurrence pancreatitis in the alcoholics that causes permanent damage, right? And can lead to diabetes because the pancreas no longer functions the way it does. And the pancreas has two functions, an endocrine organ and an exocrine organ, which helps with digestion. So you have malabsorption, right? You have malabsorption, and then you develop diabetes, right? So the endocrine and exocrine part of this. So this is a serious problem related to the misuse of alcohol. And so alcohol brings a lot of issues that I've talked about in prior. Right? I didn't even go talk about the destabilization of families, the domestic violence, and things like that. Right? So we have to be aware of this. We have to educate ourselves. Right? So the typically it's a sharp epigastric pain radiating to the back. Epigastric meaning right under your breastbone, right? And it's painful, right? So the plan is hospitalization, IV fluids, right? Nothing to eat, nothing to drink, right? And let your bowels rest. But you have to stop alcohol use. Alcohol cessation is the cornerstone to prevent recurrence, all right? And you have to get on top of your nutrition, good nutritional support. And if it gets to the point where you have chronic pancreatitis, where your digestion is affected and your diabetes, your blood sugar management is affected, then you have to be on supplement. You have to be on pancreatic enzyme replacement. You have to be treated for diabetes. Pain management is one of the most difficult challenges, is to control chronic pancreatitis pain. All right, so we need to talk about detoxification. We need to talk about alcohol rehab programs, and start putting things in place to help all people. Because I can tell you, pancreatitis is not a nice way to go. It's painful, right? And alcohol, poverty, health inequality, all these things goes hand in hand, right? And you stress and despair drives the alcohol use, all right? Especially in marginalized and poor communities. So we have to educate ourselves. We have to keep telling ourselves that these are the things that's destroying us, right? Our social inequities affects our health. This poverty that we found ourselves in affects our health, right? The medicines and everything else focuses on the acute management, but long-term management has to do with you staying away from alcohol, right? And focusing on your health, better nutrition, right? And that's the way we can prevent alcohol-related pancreatitis, right? These are the type of diseases that truly requires social reform, education, and investment in community health, right? So I just wanted to put that out there, because a lot of times, people have the pain, they're throwing up, it's getting worse, it goes through the back, and they don't know what it is. Especially after bouts and bouts of drinking, you most likely have pancreatitis. And I'm sure there's a lot of folks that have died from pancreatitis, but without the proper diagnosis, the proper management, and the proper autopsies, you don't know. So you might dismiss it off as a heart attack or something else and things like that. So I just wanted to put that out there. Pancreatitis related to alcohol use. I'm Dr. Dangleben on behalf of Patient Choice. Have a great day. Peace.